Ever feel like every NCLEX question sounds right? That's because nearly 80% of the exam repeats the same 5 tricky question types. Today we're decoding those patterns, so you can think like the test maker and stop second-guessing your answers. As you go through, drop your score in the comments and like this video if you're ready to conquer the NCLEX. Let's dive in. Question 1. Priority and safety. A nurse enters the room of a post-operative client who is restless, has an O2 saturation of 88%, and is complaining of difficulty breathing. What is the nurse's priority action? 1. Administer prescribed pain medication. 2. Reposition the client's head and neck. 3. Notify the healthcare provider. 4. Increase IV fluids. The correct answer is 2. Reposition the client's head and neck. Rationale. Airway comes first. Restlessness plus low O2 equals airway obstruction or hypoxia. Repositioning opens the airway. Pain meds or IV fluids would worsen hypoventilation. Notify the provider after the airway is stabilized. CliniqueRN test day tip. When you see restlessness, low O2, or difficulty breathing, always think airway first, not provider first. Question 2. Which client should the nurse assess first during morning rounds? 1. A client with COPD with SpO2 of 90% on 2 liters of oxygen. 2. A post-op appendectomy client with pain rated 8 out of 10. 3. A client with diabetes who is diaphoretic and shaky. 4. A client with a stage 2 pressure ulcer awaiting a dressing change. The correct answer is 3. A client with diabetes who is diaphoretic and shaky. Rationale. Diaphoresis plus shakiness means possible hypoglycemia, which can lead to altered LOC, which is airway loss. COPD with SpO2 90% is baseline. CliniqueRN test day tip. Don't confuse chronic with critical. A new acute symptom, like hypoglycemia, beats chronic issues every time. Question 3. A client receiving nitroprusside infusion has blood pressure 88/52 and heart rate 110. What should the nurse do first? 1. Notify the provider. 2. Slow the infusion rate. 3. Assess for cyanide toxicity. 4. Obtain another set of vital signs. The correct answer is 2. Slow the infusion rate. Rationale. Sudden hypotension means excessive vasodilation. The immediate action is to slow the infusion, intervention. Assessment options? Delay life-saving action. CliniqueRN test day tip. When data already confirms instability, like low BP, act. Don't assess. Question 4. A nurse finds a post-op patient coughing up thick secretions. What should the nurse do first? 1. Encourage deep breathing and coughing. 2. Auscultate lung sounds. 3. Notify respiratory therapy. 4. Increase IV fluids. The correct answer is 2. Auscultate lung sounds. Rationale. You don't yet know the cause. Assess before acting. Auscultation confirms if there are retained secretions, atelectasis, or obstruction before choosing an intervention. CliniqueRN test day tip. When you see vague findings, pause and ask, do I have enough data to act? If not, assess. Question 5. A client taking digoxin reports seeing yellow halos around lights. Which lab result should the nurse review first? 1. Potassium level. 2. BUN and creatinine. 3. Hemoglobin. 4. Calcium. The correct answer is 1. Potassium level. Rationale. Low potassium increases risk for digoxin toxicity, manifesting as visual disturbances and arrhythmias. CliniqueRN Test Day Tip. Whenever you see yellow halos, think, check K+ before calling the provider.
All right, quick break, because I need to show you something that can actually change the way you study for the NCLEX. This is our AI feedback system, built right into the QBank dashboard. After every quiz, you don't just get a score. You get personalized insights that explain why you miss questions, where your weak spots are, and how to fix them. For example, it tells you things like which subject areas need urgent review, whether you're rushing through questions and leaving test time unused, step-by-step recommendations like taking focus quizzes to sharpen delegation, prioritization, or clinical judgment. Instead of just saying you scored 60%, it literally gives you a roadmap to improve. And that's just one part of the QBank. You'll also get challenging NCLEX-style questions that test real critical thinking, a clean summary sheet that tracks your progress over time, and a built-in computer adaptive test system so you can practice under real exam conditions. This isn't just question practice. It's smart, AI-driven coaching that helps you study smarter, not harder. If you're serious about passing the NCLEX on the first try, check the link in the description and start using the QBank today.
The nurse prepares to administer lithium to a client with bipolar disorder. Which finding requires the nurse to hold the medication? 1. Sodium 133 milliequivalents per liter. 2. BUN 18 milligrams per deciliter. 3. Creatinine 0.9 milligrams per deciliter. 4. Temperature 98.9 degrees Fahrenheit. The correct answer is 1. Sodium 133 milliequivalents per liter. Rationale. Low sodium equals risk for lithium toxicity due to decreased renal excretion. CliniqueRN Test Day Tip. Always check sodium and renal labs before giving lithium. Low sodium equals hold and notify provider. Question 7. A client receiving IV vancomycin develops redness and itching on the upper chest and neck during infusion. What should the nurse do first? 1. Stop the infusion immediately. 2. Notify the provider. 3. Slow the infusion rate. 4. Document findings and continue. The correct answer, 3. Slow the infusion rate. Rationale. Redmond syndrome from rapid infusion is not an allergy. Slow the rate, not stop it. CliniqueRN Test Day Tip. If it's infusion-related, not anaphylaxis, slow it down before you shut it down. Question 8. Which task can the RN delegate to an experienced UAP? 1. Feeding a client with a new stroke and dysphagia. 2. Obtaining vital signs for a client 30 minutes post-surgery. 3. Assisting a stable client to ambulate after hip replacement. 4. Teaching incentive spirometer use. The correct answer, 3. Assisting a stable client to ambulate after hip replacement. Rationale. UAP can assist stable clients with routine care. Feeding stroke clients or post-op vitals equals RN responsibility due to aspiration and instability risks. CliniqueRN Test Day Tip. If the client is stable and predictable, delegation is safe. If not, keep it. Question 9. Which task is appropriate for an LPN to perform under RN supervision? 1. Initiate a blood transfusion. 2. Monitor a client receiving IV antibiotics. 3. Develop a care plan for a newly admitted client. 4. Teach a client how to self-administer insulin. The correct answer, 2. Monitor a client receiving IV antibiotics. Rationale. LPNs can monitor stable clients with IV therapy, but cannot initiate transfusions, perform teaching, or create care plans. CliniqueRN Test Day Tip. If the question says monitor, it often refers to an LPN. If it says initiate, assess, or teach, It refers to RN. Question 10. The RN is delegating to a UAP. Which instruction is most important to give? 1. Report any changes in the client's urine color. 2. Take all vital signs every 2 hours. 3. Ambulate the client twice today. 4. Assist with meal trays. The correct answer is 1. Report any changes in the client's urine color. Rationale. Delegation includes clear communication of what to report. UAPs observe and report changes but do not interpret them. CliniqueRN Test Day Tip. Always pair delegation with specific reporting instructions. Question 11. The RN supervises a new LPN administering medications. Which observation requires immediate intervention? 1. LPN verifies client's ID before giving meds. 2. LPN gives potassium without checking labs. 3. LPN crushes a scored tablet. 4. LPN documents after administration. The correct answer is 2. LPN gives potassium without checking labs. Rationale. Administering potassium without verifying K+ can cause cardiac arrest. Options 1, 3, 4 are proper practice. CliniqueRN Test Day Tip. Any electrolyte med equals always verify labs first. It's the difference between safe and sentinel event. Question 12. Which findings suggest hypocalcemia? Select all that apply. 1. Numbness around lips. 2. Muscle cramps. 3. Constipation. 4. Positive Trousseau's sign. 5. Drowsiness. The correct answers are 1, 2, and 4. Rationale. Low calcium means hyperexcitability, tingling, spasms, positive Trousseau. Constipation and drowsiness occur with hypercalcemia. CliniqueRN Test Day Tip. Think C equals Chvostek, cramps, convulsions for hypocalcemia. Question 13. A nurse reviews client's lab results. Which are at risk for bleeding? Select all that apply. 1. Platelet 80,000. 2. INR 4.0. 3. APTT 25 seconds 4. Hemoglobin 9 grams per deciliter. 5. Client on heparin. The correct answers are 1, 2, 4, and 5. Rationale. Thrombocytopenia, elevated INR, anemia, and anticoagulant therapy increase bleeding risk. APTT 25 seconds is normal. CliniqueRN Test Day Tip. Low platelets or INR greater than 3 equals bleeding before you even touch the patient. Question 14. The nurse teaches a client with warfarin therapy. Which statements need further teaching? Select all that apply. 1. I'll eat spinach 3 times a week. 2. I'll use a soft toothbrush. 3. I'll take my warfarin at the same time daily. 4. I'll stop the drug if I notice bruising. 5. I'll tell my dentist I'm taking warfarin. The correct answers are 1 and 4. Rationale. Green leafy vegetables, vitamin K, reduce warfarin efficacy. Stopping the medication abruptly, option 4, risks clot formation. Other statements show correct management. CliniqueRN Test Day Tip. Never stop warfarin on your own. Report bruising. Don't self-discontinue. Question 15. Which tasks can an LPN safely perform? 1. Reinforce discharge teaching. 2. Monitor stable diabetic client. 3. Assess post-operative bleeding. 4. Start blood transfusion. 5. Administer oral antibiotics. The correct answers are 1, 2, and 5. Rationale. LPN scope includes reinforcing, monitoring, and routine med admin for stable clients. Assessment or initiating blood transfusion equals RN role. CliniqueRN test day tip. If the word initial appears, assume it's RN territory. Question 16. Which actions are appropriate for a client with suspected hypoglycemia? Select all that apply. 1. Check blood glucose. 2. Administer orange juice if awake. 3. Notify provider before testing. 4. Recheck glucose after 15 minutes. 5. Give insulin to stabilize. The correct answers are 1, 2, and 4. Rationale? Classic 15-15 rule. 15 grams of carb means recheck after 15 minutes. Never give insulin during hypoglycemia. That worsens it. CliniqueRN test day tip. When in doubt, check first, treat second. Labs guide life-saving action. Question 17. A client with pneumonia suddenly becomes confused and agitated. What is the nurse's priority action? 1. Reorient the client. 2. Check O2 saturation. 3. Notify provider. 4. Obtain blood glucose. The correct answer is 2. Check O2 saturation. Rationale. Acute confusion in infection means likely hypoxemia, not dementia. Reorienting, option 1, treats the symptom, not cause. Glucose, option 4, can cause confusion, but oxygenation must be ruled out first. CliniqueRN test day tip. Sudden confusion means check oxygen first, glucose second, infection third. Question 18. A diabetic client receiving NPH and regular insulin at 0,700 should be monitored for hypoglycemia at which time? 1. 0,800 to 0,900. 2. 0,900 to 1,100. 3. 1,300 to 1,500. 4. 1,700 to 1,900. The correct answer is 2. 0,900 to 1,100. Rationale. Regular insulin peaks 2 to 4 hours post-dose, approximately 900 to 1,100. NPH peaks later, 4 to 12 hours, so the earliest danger window is 900 to 1,100. CliniqueRN test day tip. Remember, regular equals 2 to 4, NPH equals 4 to 12 inches to anticipate hypoglycemia timing. Question 19. The nurse observes the UAP ambulating a post-op client with a chest tube when the tube accidentally disconnects. What is the nurse's first action? 1. Reconnect the tubing. 2. Place the end of the tube in sterile water. 3. Notify the provider. 4. Clamp the chest tube. The correct answer is 2. Place the end of the tube in sterile water. Rationale. Submerging in sterile water recreates a water seal, preventing air entry. Clamping, option 4, risks tension pneumothorax. Reconnecting, option 1, can introduce air or pathogens. Notify after securing seal. CliniqueRN test day tip. If the chest tube disconnects, seal it before you heal it. Question 20. A nurse prepares to administer metoprolol 50 milligrams PO. Which finding requires the nurse to withhold the medication? 1. B. P118/76. 2. HR 52. 3. Blood glucose 92. 4. RR 18. The correct answer is 2. HR 52. Rationale. Metoprolol, beta blocker, slows heart rate. HR less than 60 beats per minute means hold dose, prevent bradycardia or heart block. Other values are normal. CliniqueRN test day tip. Always check apical pulse before beta blockers. If it's slow, don't go. Great job, future nurses. Tap the link at the top corner for your free daily NCLEX practice from CliniqueRN. Don't forget to like, subscribe, and drop your score in the comments. Let's see who got the highest today. Keep learning, keep decoding, the CliniqueRN way.